Welcome to North Tees and Hartlepool Voices, telling the stories of our people and community in our trust.
Hello, my name's Elliot Kennedy, and in the studio today we have Julia and Bernice from the TDST. Exactly what is the TDST?
So the TDTS is the Tobacco Dependency Treatment Service. We've been here at the Trust for over 2 years now, and we're here to support staff who care for patients identified as smokers. What we recognise is that tobacco dependency is a chronic and relapsing medical condition, and patients who are in a forced abstinence when they're entering the hospital site, which is smoke-free, will quickly go into withdrawal. And that's a little bit different to a quit attempt because it's forced upon the patient. They'll feel a lot of unpleasant symptoms within 2 hours of not having a cigarette. They'll feel irritable, they'll get headaches, they could get nausea, vomiting, bowel disturbance, palpitations, sweating. It really is uncomfortable and completely preventable if we do ask patients the smoking status and offer them some treatment in the form of nicotine replacement therapy.
How is frontline staff supporting patients with a tobacco dependency?
So nicotine withdrawal is a real thing, and the frontline staff can support patients by offering very brief advice. Very brief advice has 3 elements: ask, advise, act. So the ask element is asking the patient for their smoking status and recording this status on the nursing admission notes on track care, advising that we are a smoke-free site and they can assess this support through the tobacco dependency treatment service in hospital. So they can offer nicotine replacement therapy prior to the visit of a tobacco dependency advisor. And the ACT element is the last one. Kindly refer to the inpatient tobacco dependency treatment service, and then an advisor will come round and chat to the patient, create a plan, possibly a quit plan if they're going on to make a quit attempt, and then the staff can kindly offer nicotine replacement therapy to manage the nicotine withdrawal.
Do you have the resources available to help frontline staff identify and treat the tobacco dependency?
Yeah, so we recognise that ward staff across the Trust face so many pressures every day, and there's so much to cover within the daily duties that we want to make life easier where we can in treating tobacco dependency. So what we've developed is a frontline staff quick guide bundle, and this is going to help staff to do their element in supporting patients who are forced to be smoke-free as easy as possible. So what we do have is staff are very welcome to some free banner pens, which we have endless supply of still, that show how to provide very brief advice that Bernice has kindly explained. We also recognise that we could do with making the referral process itself as simple as possible. So as much as staff are still welcome to use the ICE referral system to notify our team of any identified smokers, we've actually managed to get a lot of support from the digital teams, and we're automatically notified now of all smokers. The staff element is to ensure that they fill in the smoking assessment on the nursing admission note. So literally anyone there where it says a smoker on that, it gets pinged over to our team and we find out straight away. So that's been really brilliant, and we're seeing from as little as 35 smokers on day one of service, that was the month, to over 270 smokers a month now. And for those patients, that's making a massive difference. It's making them more comfortable, and it's resulting in quit attempts in 1 out of 3 patients' cases. So it's really, really brilliant. We also want to make it easier to discuss nicotine replacement therapy options with patients and to prescribe nicotine replacement therapy. So there is like a nicotine replacement therapy decision aid. I can send them out to anyone on request. There's already been a lot of requests coming through with it going out on Trust Comms, and it's proven popular. It's very simple. It shows you some of the medicines that are available and how to decide on the right one. And then another one is like a prescribing prompt for the staff, just to show how simple the system is now on our track care in getting nicotine replacement therapy prescribed. You just literally need to put NRT and it populates your list and your update. So it's like 2 clicks. It's brilliant. So that's the resources, and I feel confident they're going to really help the process for the ward staff.
And exactly what does your dependency team do?
So as Bernice has kind of touched on, again, we appreciate the ward staff are busy, and their element is just to literally ask a patient's smoking status and to quickly offer some nicotine replacement therapy. So in order to really get a true understanding of a patient's level of dependency to nicotine, we would have a 40-minute bedside assessment, which patients really appreciate someone sitting down and having a full discussion around this and showing some understanding around it, because it's really important that we're non-judgmental. It is an addiction that's usually occurred from early in childhood, so it's something that does need treatment and recognition and understanding. And then patients may have had past quit attempts. We can discuss them, what they've tried before, what works, what doesn't. And then really not put the pressure on, but just kind of say what support's available. So that would be nicotine replacement therapy or vapes, which are in line with the treatment of the nicotine replacement therapy. And then just develop a plan. It might just be to stay smoke-free for the inpatient stay, but as I said, it does convert a lot of patients that might not have been expected to go on to do a quit attempt on discharge.
Now, you said, mentioned vapes there. Is it the same as smoking?
No, not at all. So vapes are significantly less harmful than smoking. There's no combustion, so there's no smoke, and as a result of that, there's no carbon monoxide release, there's no tar, and all the toxins and chemicals you find in the cigarettes, you won't find them with the vapes. The vapes are regulated for quality and safety, so I would definitely say a vape is significantly less harmful than smoking, and it's a very good substitute for people who want to stop smoking. We do not advise children to use vapes, so I would say if you've never smoked, do not vape. Just to add that when you want to buy vapes, it's better to buy from a reputable source. So I'll say like the supermarket, as compared to other places where we're not sure if the vapes are regulated or not, because we don't know what's in them. But when you buy from a reputable source, you know it's just nicotine, and then the vape is delivering nicotine to the body in a less harmful way than cigarette smoking. Like I said earlier, there's no carbon monoxide, there's no tar. All the toxins and chemicals you have in the cigarettes and tobacco you will not find, so it's best to source them from a reputable place.
How do people get in contact with you?
So the quickest way it would be to just contact our office number. So that would be, it's an internal contact number, but 01642 383 813.
And is there anything else you two would like to add?
No, just keep doing your bit, working hard. You're all doing an amazing job, and we can support you to support patients with tobacco dependency.
Julie, Bernice, thank you.
Thank you.
Thank you.
Thank you for joining us. Till next time, you've been listening to NTH Voices.